Hey, this is Joseph, inventor of Friendly Shoes and licensed occupational therapist, here to talk to you today about plantar fasciitis. We've been getting a massive amount of inquiry, both through email and direct messages, regarding plantar fasciitis and questions whether there is an appropriate footwear that could help relieve the symptoms. So we wanted to start this discussion about just talking about the actual symptoms. From what we've looked up online and what we've seen in practice, sharp pain in your foot that tends to have an origin in the heel area tends to be the most common symptom. This pain level is increased in the morning following periods of prolonged immobility, right? You're sleeping, everything tends to tighten up when you're sleeping, you're not on your feet. You wake up in the morning, it feels like you're walking on glass. We're going to give you some strategies to help kind of get you going in the morning, which is really important to engage in all of your morning routine activities. First, we're going to go into the risk factors, right? As you get older, you're going to be more prone for, this inflammation of your plantar fascia. If you are obese or overweight, tends to put a little more pressure on that area. Also, individuals that do not wear shoes that are supportive. You're also looking at the body mechanics of your gait. Everyone walks different. Everyone has different arches. Sometimes the arches on one foot are not the same as the arches on the other. So you need to consider, the positioning of this through your footwear. When you wake up, as I said before, in the morning, it tends to be favorable to a simple technique that we used to recommend is freeze a bottle of water. They have these 16.9 fluid ounce bottles of water. You wake up in the morning, take it out of the freezer, and you can just roll your foot, right? You roll it, you're going to get the benefits of the ice to reduce the swelling. You're also going to get the benefits of just working out that tightness in your fascia. Stretches tend to be favorable too. You're also going to have to consider your activities throughout the day. If you're a prolonged stander, any type of footwear that you use, in addition with these manual treatments with the rolling out and stretches that we do recommend, highly recommend, you're going to make sure you're going to want to modify your daily routine. So those nurses, you're working on your feet 12 hours. Other individuals, doing their 8-hour day, a 40-hour-a-week job, and you're standing all the time. See if there's any adjustments you could make where you could go ahead, sit down, take a rest, and intermittently provide your plantar fascia a rest. With these treatments, we feel that our Friendly Shoes, in addition to other shoes, might be super beneficial to you in relieving the symptoms, right? You're looking for a good arch support, you're looking for a good cushion within the shoe, and you're looking for the ability to make adjustments when needed. There's scenarios where when you're trying all of these treatment ideas, the shoe support, the actual stretching, the manual treatment, NSAIDs, which are just basically pain relievers and anti-inflammatories, they're not working. In this instance, and you're going to have to consult a physician, right? They do have strategies that if these simple strategies don't work, then you're going to have to, report to an orthopedic or a podiatrist, a specialist in your musculoskeletal system that's going to give you, potential strategies of steroids. You want to stay away from surgery for the short term until you try, maybe going to a physical or occupational therapist. Having their strategies, having an individual to be able to actually manipulate your feet might be super beneficial. It's just important when you're looking at shoes out there, there's no way in the world that you're going to resolve a plantar fasciitis just from getting shoes, right? Make sure you have a shoe. Every shoe is lasted on a different type of, it's that fake foot. You stretch the upper around. It's lasted. This may or may not accommodate your foot. We have seen pretty good benefits with leather or materials on the upper that are able to kind of conform to the specialization of your feet, the angles that God gave you. So it's going to be able to conform to this. You have good arch support in the shoe that's going to keep everything snug. Try to be pretty compliant with this program, right? What we recommend is in the morning, you wake up and you go ahead and do your stretches. you go ahead and do this ice, which is going to be nice in conjunction with your pain-relieving anti-inflammatory drugs. If you have any medical conditions, you have to talk to your doctor about the proper meds to take. Everyone is different. This, in addition to changing your routine, having appropriate footwear, could be super beneficial. We recommend the stretching and manual treatment in the morning. If you can in the afternoon, which is sometimes hard during our crazy work schedule here in the United States, and then in the evening. All right. So essentially, you're working out the muscle, bringing down the inflammation, and trying to keep as much support as possible. This area is going to have a fair chance of recovery. If you have any questions, we are trying to help everyone as best as possible with any type of footwear challenges that you're having, including plantar fasciitis. My name is Joseph. Again, joseph@friendlyshoes.com. I'd be happy to answer some of your stuff, questions, creative questions if you have them. I'd be happy to kind of get in there and try to answer. If I don't have the answer, I'm going to try to look it up. And if I can't do that, I'm going to refer you to an appropriate medical professional that handles this stuff specifically, because it is specific based on all the structures, muscles, tendons, bones that you have in your feet. So any questions, joseph@friendlyshoes.com. I really appreciate you listening to this informative session by Friendly Shoes. Hope to speak with you soon. Be friendly.